Let me introduce today's speaker, Dr. Juliet Golden, who divides her time between Warsaw and Norman, Oklahoma, is a faculty member at Syracuse University and the director of Syracuse's Study Abroad Central Europe program. Her research and teaching center on the politics of memory, the history of women and public health, and architecture and public space in Central Europe. We had a nice talk just now about what that really means, Central and East Central Europe. In her recent work, she brings to light the stories of individual memory activists engaged with the marginalized Jewish heritage of Poland's urban spaces, with a particular focus on Wrocław, formerly Breslau, Poland, formerly Germany. Today, she will speak about a key figure in the history of emergency medical relief and public health in both interwar Poland and during the Holocaust. And we're extremely pleased to welcome Professor Juliet Golden.
Thank you, Professor Levinson, for the introduction and for the invitation to speak to the Schusterman Center community at OU. I would also like to express my gratitude to Professor Rona Seidelman for her part in making this day happen and for her meaningful and generous support in the early phase of this research. My thanks also goes to Trice Hyman for his help in the background. It is appropriate, if not serendipitous, that my talk is taking place at the beginning of March, at the start of Women's History Month. I will be speaking about one woman, a Jewish medical doctor who responded to humanitarian disasters in Europe in the first half of the 20th century. My focus will be on a public health crisis that took place in post-World War I Poland, but I will also touch on the period of World War II and the Holocaust. At the start, I would like to point out that many of the cities and regions that figure in my talk are in today's Ukraine. These places were not only significantly impacted by World War I and later World War II, they are once again battlefields in Russia's war against that country. Living in Central Europe and studying Central Europe, one becomes keenly attuned to anniversaries, both recent and more distant. The third week of February marked the 10th anniversary of the Revolution of Dignity in Ukraine and the second anniversary of Russia's launch of the full-scale invasion of the country. The 79th anniversary of the liberation of Auschwitz-Birkenau passed in January. In starting, I would like to point to another less visible anniversary. 81 years ago, on January 18, 1943, on the orders of Himmler, the Germans began the second mass deportation operation from the largest ghetto in Nazi-occupied Europe, the Warsaw Ghetto. At its peak, an estimated 450,000 Jews were enclosed in a space that was about 1.3 square miles. During the deportation operations, residents of the ghetto were rounded up in the streets, forced into train cars, and taken to death camps. The largest mass deportation from the Warsaw Ghetto began in July 1942 and lasted until September 1942, during which an estimated 265,000 men, women, and children were sent to Treblinka. 4 months later, on January 18, 1943, many medical practitioners, doctors, nurses, and other healthcare workers became unsuspecting targets of the second mass deportation. Among those captured was Sarah Zofia Sirkin-Binštejnová, a prominent doctor and activist based on multiple accounts from that day. Sirkin-Binštejnová carried morphine and injected numerous doctors with death-inducing doses prior to taking her own life. This group suicide took place either at the assembly point for the transportation to the death camp's Umschlagplatz or on the train to Treblinka. So who was this woman who moved from doctor to doctor, injecting them with morphine to help them avoid death in the gas chambers of Treblinka? In the Warsaw Ghetto, Sirkin-Binštejnová held visible positions in Jewish self-help networks and in the Jewish Council. Yet she is largely missing from scholarly accounts. One of her contemporaries and friends, Michel Mazur, in his own study of everyday life in the Warsaw Ghetto, called Sierkin-Bińsztejnowa, and I quote, one of the major figures in Warsaw Jewry. But he fails to mention her again, unfortunately, in the rest of his book. Similar anecdotal appearances are scattered in a number of studies in published and unpublished autobiographical accounts by Holocaust survivors and in reports made by chroniclers in the Warsaw Ghetto. Through my own research, I would like to contribute to the restoration of her biography, her story. In so doing, I foreground a largely unknown chapter in her life, her medical work, and her in early interwar Poland. I recount how, utilizing the digitized archives of the American Joint Distribution Committee, I located a vast cache of primary materials on the formative period of Sierkin-Bińsztejnowa's medical career. Pulling from hundreds of documents found online, I was able to piece together a more complete picture of this forgotten medical professional from a time when she served on the front lines of public health and hygiene campaigns in Poland. What emerges are not only important details of the central role she played in the battle against epidemics in the aftermath of World War I in a region of southern Poland known as West Galicia, but also a portrait of a key institution builder who in the early years of Poland's independence took the lead in the shaping of the public health system for Poland's Jews. Oops, I did that? No. The largest Jewish community in Europe and the second largest in the world. My mining of the Joint Distributions Committee's digitized archives in search of Bińsztejnowa began as an unexpected spin-off of a family research project. My grandmother's brother, my great-uncle, Dr. Erwin Michlin, was sent to Krakow as a medical commissioner by the Joint in 1921. In the aftermath of World War I, the Joint launched a series of relief programs in Eastern Europe to overcome the dire humanitarian crisis resulting from the ravages of World War I and the Polish-Soviet War of 1919-1921. Typhus and other diseases of conflict and destitution were decimating populations. Ludwig Hirschfeld, the Polish Jewish bacteriologist and serologist who was a pioneer in modern blood typing, described a crisis of global proportions. World War and Civil War had provoked the greatest epidemics the world had ever known, Hirschfeld wrote. The alarm bells were also sounded in these two articles published in the Washington Post and the New York Times in the spring and summer of 1920. In response to the global crisis, the League of Nations Epidemic Commission, working closely with the Polish government, put in place a sanitary cordon along Poland's eastern borderlands in an attempt to block the spread of typhus. As a part of these international containment efforts, the Joint Distribution Committee allocated $2 million for medical relief to supply hospitals, fight epidemics, and carry out a public hygiene campaign largely for the Jewish populations. The relief and reconstruction work programs were to be implemented by a medical unit directed to Eastern Europe at the beginning of 1921, made up of medical doctors, public health specialists, a dentist, a pharmacist, and a secretary. Poland was divided into 7 districts and with commissioners setting up offices in the largest towns of each of these regions. Appointed as the medical commissioner for West Galicia, my great-uncle Erwin Michlin set up his offices in Krakow, which is where he first met and began working alongside Sierkin-Bińsztejnowa. The Joint Archives are rich in descriptions of the day-to-day work of the doctors against a backdrop of poverty epidemics, intercommunal strife, practices of exclusion, and nation building. They document, for example, the destruction of communities by warfare and pogroms. The archives also contain reports on local epidemic outbreaks and the spread of illness. We can all probably, after the COVID-19 pandemic, recognize this image of an epidemic curve. This one was plotted by Sierkin on graph paper and follows the spread of the typhus epidemic in West Galicia in 1920. Here is a photo of an emergency sanitary team deployed to an outbreak site in East Galicia, which is in today's Ukraine. Yet women are underrepresented in the Joint's archives from the period. The majority of reports in the collections were penned by men as an outcome of what was in effect a male-only hiring policy for the medical unit. As a result, qualified female candidates, with in some cases more experience than their male counterparts at carrying out international medical relief work in war zones, were not considered. While marginalized women's histories can be recovered, though, the more I reviewed the documents searching for my family's history, the more Sirkin-Binštejnova leapt out of the page and demanded attention. This realization led me to return to the Joint's archives in search of her narrative. By placing Sirkin-Binštejnova at the center as a protagonist in subsequent searches and seeking out information from other scattered sources, her agency as a foremost figure in the relief works in West Galicia and in the post-World War I era By placing Sirkin-Binštejnova as the protagonist in subsequent searches and seeking out information from other scattered sources, her agency as a foremost figure in the relief efforts in West Galicia in post-World War I era and in the subsequent launching of the National Jewish Health Organization in Poland, known by the abbreviation TOZ, or TOZ, emerged. In order to tell her story, I will begin with first considering Sirkin-Binštejnova's early life and the early steps in her medical career. I then move on to present in some detail her public health work in the post-World War I Poland. I conclude by examining Sirkin-Binštejnova's emergency medical work in the Warsaw Ghetto through the prism of her early interwar experience. You will notice here that there are different versions of her name associated with each of these periods. In her early life, she was known as Sora Sirkin, which is the name that appears on her medical school diploma. After World War I, she shifted from her Yiddish first name to Zofia, perhaps marking a transition away from the traditions of the somewhat hermetic Jewish world to her active presence in the newly independent Poland. In the mid-1930s, she adds Sarah to her first name, which may reflect a return to her roots at a time of erosion of the position of Jews in Polish life in Poland in the mid-1930s. So now let's turn to Sora Sirkin's early life and education. Sora Sirkin was born on December 15th, 1891 in Bielsk, a city in the Russian Empire, which is today known as Bielsk-Podlaski in Poland. At least three of the Sirkin children, 2 daughters and 1 son, went into the medical profession, a reflection of the weight placed on education for both male and females in the family. One daughter, Fanny, became a bacteriologist and during the Second World War emigrated to what was then Palestine. Another brother, Efim, specialized in internal medicine. Due to the quotas limiting the number of Jews accepted in universities, Efim sought a medical education abroad in Switzerland and in Breslau, Germany. Sora Sirkin, however, stayed in Russia and was accepted into the Kiev Higher Courses, a school for women with a medical program affiliated with the medical faculty of St. Vladimir Royal University of Kiev. The Kiev Higher Courses was one of only 7 medical programs open for female students in the Russian Empire. The school also accepted Jewish students. At the time of her studies, every 4th student at the Kiev Higher Courses was Jewish. From this notarized translation of her diploma, we learn that Sirkin was awarded the title of medical doctor on August 16, 1915, at the age of 23. She was among approximately 1,000 women to have graduated from medical school that year in Russia. With the First World War enveloping the continent, after graduation, Sirkin moved to Moscow, where she was employed as a doctor at the Red Cross Hospital, a position that provided her with coveted hospital experience and postgraduate training. She subsequently worked as a sanitary doctor in the municipal health system and as a school doctor. In 1917, after the outbreak of the Russian Revolution, Sirkin returned to Kiev and her alma mater, where she was employed as an assistant in the university hospital, working under Vasily Obraztsov and his pupil Nikolai Strazesko, 2 pioneer cardiologists who achieved international renown for having in 1910 described for the first time non-fatal myocardial infarctions or heart attacks in the clinical setting. In October 1918, 1 month before the end of World War I, Sierkin departed for Warsaw, the soon-to-be capital of a newly independent Poland. So now I will turn to Zofia Sierkin's work in interwar Poland. The end of World War I brought Poland independence for the first time in 123 years. But the country was devastated economically and physically with the health crisis caused by ongoing wars and epidemics, which was spinning out of control. In 1920, the Polish government created the Extraordinary Epidemic Commissariat headed by a typhus czar, or a typhus dictator, empowered with special emergency staff and extraordinary powers to mobilize resources to lead a coordinated national campaign to halt epidemics. A physician draft was enacted and doctors were placed at the disposal of the commissariat. Sora Sierkin, now figuring in the archives as Zofia Sierkin, was mobilized to the army in March 1920 and delegated almost immediately to work in Krakow. In Krakow, Sierkin was charged with the formation of what was called a sanitary section of the Jewish Relief Committee, an institution established in 1919 to coordinate emergency aid efforts in this region with a large Jewish population that had been impacted greatly by World War I. She led the sanitary section for 10 months. Her first step in this position was to survey the region to understand the scope of the epidemic and set the parameters of the medical sanitary response. The picture emerging from this survey was a region which, in Sierkin's words, was perfectly helpless before the terrible enemy of typhus. In 1919 and in the first 10 months of 1920, West Galicia was hit with 23,279 cases of typhus, with a case fatality rate of 14%. The Jewish population, made up of mostly urban dwellers, was particularly hard hit. 30% of those ill with typhus in Krakow were Jews, but they only accounted for 17% of the overall population of the city. The situation in the countryside was worse. In Szyniawa, a town in eastern Galicia where this delousing station was set up, 3/4 of the population lived in overcrowded, primitive barracks. In a report from Szyniawa, Sierkin described the extreme destitution. She reported barracks where lice were visible crawling on the ceiling. The design of barracks with narrow corridors and tiny rooms failed to provide a modicum of hygienic living. She described felt-covered walls radically swarming with parasites. Medical staff removed 300 lice from the head of one girl aged 12. Central to Sierkin's medical relief work was the launch of a bottom-up effort to stave the epidemic through community education and house-to-house cleanup. Her education program included the distribution of 60,000 informational how-to flyers in Yiddish and Polish that informed the Jewish residents of West and parts of East Galicia about proper daily hygiene and cleanliness practices. The instruction flyer on the left lists 7 points on how to clean one's home. The flyer on the right discusses specific personal hygiene practices that should be followed, especially in a time of epidemics. These handouts were written in a language suitable to a range of worldviews and lifestyles. Communiques were published in Jewish newspapers and distributed in Jewish schools and synagogues, as well as from door to door by youth volunteers. Here we see signs with public health information posted on a wall behind starving refugees. Health and hygiene lectures were delivered in synagogues and other public places, and thematic conferences were convened for Jewish community leaders. The heart of the sanitary program was the cleanup movement. Over a period of 3 months, Sierkin led the first in a series of public campaigns to clean up Jewish homes. Jewish neighborhoods were divided into sectors. Trained doctors and medical assistants moved door to door, inspecting Jewish living quarters and the inhabitants. If homes were deemed dirty, a cleaning date was set. The cleaning would be carried out by the residents themselves under the guidance of the physician who would arrive on the appointed day with cleaning supplies. Residents received tickets for a free bath at a temporary facility situated in tents in the Kazimierz neighborhood of Krakow. Before showering, bathers were required to hand over their clothes for cleaning and delousing. The clothes would be returned only after submitting proof that the individual had visited the public bath. Over a 4-month period between June 26th and October 1st, 1920, Sirkin Sanitary Section inspected 5,748 homes and 26,694 individuals. As this report prepared by Sirkin indicates, inspectors found 62.5% of the dwellings to be either dirty or very dirty. During the 4 months, 1,172 homes were cleaned and 6,394 individuals received baths and had their clothes disinfected. Within months of the inception of Sirkin's sanitary section, she launched 2 key investments in Krakow: the night shelter and the ambulatory care clinic. The night shelter, also called the refugee shelter, was considered to be by Sirkin the front line against the battle against epidemics. Sirkin sourced the constant outbreaks of epidemics in Krakow to the influx of refugees, poor travelers, and destitute people entering and moving about the city, trying to escape the warfare further east. Here in this photo from 1921 and 22, we see movements of refugees in the city of Ruvne, which is in today's Ukraine. And here is a photo of a group of refugees in Krakow. In the photo, we see multiple generations, mostly men in back, women in the middle, and in the front, many children. One little girl in the lower right-hand corner is without shoes. Some children are wearing what appears to be caps and jackets from uniforms from different armies. The shoes, some not matched, some too large for the wearer's feet, have been repaired multiple times. In terms of care for refugees in the time of epidemics, prior to the opening of the night shelter, synagogues in particular had been frequently deployed as temporary shelters, creating a significant danger of the spread of lice and the range of communicable diseases to the locals who in large numbers visited these houses of prayer on a daily basis. Adapted from donated barracks, the night shelter offered the possibility for safe and clean housing. It also doubled as a public bath and a delousing station where 300 people could bathe at the shelter daily. The sleeping quarters could accommodate 192 people. All bathers received certificates confirming the date of their bath. This ticket was needed to enter the sleeping quarters. The second investment, the ambulatory care clinic, was built to fill in for the lack of a Jewish hospital. The new clinic represented one of the few places Jewish residents could go when ill. In the first month of operation in the late summer of 1920, the ambulatory treated 1,255 patients, a measure of how vital the clinic was to the local community. The Joint's medical unit arrived from the United States at the beginning of 1921. That's when Irvin Miklin, a Russian-born, US-educated medical doctor, was sent to West Galicia to serve as the medical commissioner. Formally speaking, the Joint's medical commission absorbed the sanitary section, and Sirkin became Miklin's deputy. In substance, however, the main thrust of the work in West Galicia endured in accordance with the program initiated by Sirkin 10 months prior. Miklin himself noted that when he arrived in Krakow, he was essentially just taking over the reins of a pre-existing operation, a favorable situation not all medical commissioners encountered. The work in the period was punctuated by emergency responses to outbreaks of epidemics of typhus, dysentery, and cholera. This report details how a 7-person emergency medical response team converged on Mościska after a particularly virulent typhus epidemic exploded in the town. Thematic conferences also continued for Jewish community leaders as a part of infrastructure improvement projects. Here is a photo taken during the JDC conference for rabbis held in Krakow to discuss several types of sanitary mikvahs. On the chalkboard, we see a diagram of the mikvah operating in the city of Vilnius. Within months of the medical commissioner's arrival, the Joint's medical relief program was already in turmoil. With the typhus epidemic beginning to abate, the Joint was divided over the long-term direction of the aid program. After traveling around their respective regions and seeing firsthand the devastation of war, abject poverty, and the shortage of health and sanitary facilities, many of the commissioners urged the Joint to prioritize the construction of public health infrastructure such as hospitals, public baths, and health clinics. Increasingly, however, joint leadership in New York and in Europe was reconsidering its options. Infrastructure investments would require long-term entanglement on the part of the joint, and the rebuilding alone was considered insufficient to improve the health and welfare of Poland's Jewish population. The fear was that once the joint pulled out, progress made in public health matters would backslide without public health education programs that would foster local engagement and know-how. As these policy debates were underway, after 1.5 years in Krakow, Sirkin was advanced to the position of a director in the Joint's European offices in Warsaw. She had gained credibility through her handling of the typhus epidemic in Krakow and West Galicia. More importantly, through her approach to public health, she embodied the new policy blend leaders of the Joint were advocating for. In September 21, she assumed the leadership role of the newly established Public Health Education and Propaganda Department. It was from this new post that Sirkin would launch 2 public health initiatives that had far-reaching consequences for Poland's Jews in the interwar period and beyond. The first was the establishment of the National Jewish Health Protection Society, TOS, and 2, the School for Nurses, which was closely connected to the launch of TOS. So let us now briefly turn our attention to these 2 important initiatives. TOS was the acronym for the Towarzystwo Ochrony Zdrowia Ludności Żydowskiej w Polsce, the Society for the Protection of the Health of the Jewish Population in Poland. Within months of her arrival in Warsaw, Sirkin-Binsteinova presented a 4-pronged strategy, all reflecting her experience in West Galicia, that would serve as the nucleus from around which the central public health organization would emerge. The main points in her program included plans for the launch of a national public health education program involving the dissemination of information on disease prevention and hygiene through a variety of means, including public lectures, exhibitions, home visits, and the distribution of printed informational materials. 2, the construction of public sanitary infrastructure that would, in her words, enable people to apply in practice the precepts of health and hygiene gospel. A third pillar of her program was tied to the improvement of children's health, emphasizing the need to integrate hygiene training as well as physical culture in school curricula. A special focus of concern was the health and welfare of children enrolled in religious schools. The physical development of children in Jewish schools, she argued, lagged far behind pupils in public schools where physical education was integrated into the learning curricula. In addition, the health and sanitary conditions of children in religious schools needed to be improved in order to keep these schools open. A new Polish law allowed Jewish pupils to attend heders. However, the schools also needed to pass state sanitary inspections to remain open. Sirkin-Binsteinova argued that if hygiene standards were not improved in the schools, they would close down and children would be forced into fully secularized education. The 4th point in her program called for the substantial enlargement of schools and training programs for public health personnel, and with an emphasis on nursing education. The shortage of nurses had proven a significant obstacle in carrying out the medical relief work during the epidemics in West Galicia, which mirrored chronic shortages nationwide. According to joint statistics, in 1921, there were 5,000 practical nurses registered in Poland, only 1,200 of which were considered fully qualified, that in a country of 30 million people. The Nurses Training School for Jewish Women was deemed particularly crucial in light of the fact that Jewish women were barred from attending the Red Cross nurses training programs established in Poland, a reflection on how contested the position of Jews and other minorities was in the young multi-ethnic state. In response to these exclusions, Sirkin advocated for the need to establish a school in Warsaw to train Jewish public health nurses. Sirkin prepared a 2-year curriculum modeled after the American system of nurse education. Her proposal was circulated by the Joint among an impressive international consortium of recognized experts in nursing education for evaluation, and it received high marks. An internal joint memo notes the following overwhelmingly positive response. quote, "These persons were unanimously well impressed with Dr. Sirkin's plan and considered it sound and practical, as well as in conformity with the best standards of nursing education." After Sirkin's initial proposals, the organization of the school was handed over to the Society for the Support of the School of Nursing, an organization whose sole task was the opening of the school. As we know, the school did open in 1923 and was headed by a nurse educator from the United States, Amelia Greenwald, one of the individuals asked to review Sirkin's original proposed curriculum. We see Greenwald here in the front row center of the photograph. As the Joint was phasing out its medical relief work in 1922, under Sirkin-Binsteinova's leadership, a national board of elected representatives from different parts of Poland began working on a charter for TOS, which was submitted for approval to the Polish Ministry of Health in October 1922. After 8 months of negotiations, the charter was finally accepted by the Polish government. Soon after, Sirkin invited delegates to the first National Conference of TOS in the summer of 1923. We see here a copy of the invitation in Yiddish. As a key driver in the formation of TOS and a person who earned inestimable respect among the joint leadership in Europe and New York, Sirkin-Binsteinova was offered the post as top manager, the chairperson of the organization. It is impossible to speculate based on the documents as to her motivation, but she turned the position down. However, she became one of 2 founding directors working under Gershon Levin, who would hold the post of chairman until his death in 1939. On the screen, we see a photo from the first national conference which marked the launch of TOS, attended by delegates from across the country. Fourth from the right, on the front row, we see Sirkin-Binsteinova with a pencil and a newspaper in hand. She is one of only 3 women in the photo. In October 1923, the Medical Sanitary Department of the Joint was closed down, and TOS assumed responsibility for all aspects of the Joint's medical program in Poland. On his departure, J.J. Golub, the last of the original team of medical commissioners to leave Poland, was uncertain about the future of TOS. He called TOS an experiment at best, but the experiment Sirkin launched with her transfer from Krakow to Warsaw worked. TOS became an expansive national welfare organization with a focus on promoting health and disease prevention through education. TOS also served as a healthcare provider, coordinating medical care on a national scale. TOS patients were Jews and non-Jews alike. By 1939, there were more than 50 TOS chapters in larger towns and 41 subchapters in smaller communities. I return to this photo shown a few moments ago. It's July 1931, and we are at a summer camp for children organized by the Grodno chapter of TOS. Children are on the playground, some of their heads covered, perhaps due to treatment for infectious skin disorders. In the bottom center, we see the hand-drawn logo for TOS. Here we see an excerpt from the 1926 TOS report on the school hygiene program, which in a few short years had grown to encompass 311 schools and 31,283 children. TOS ran 368 medical clinics and public health institutions and employed 962 full-time employees, including 243 physicians, 118 nurses, and 35 dentists. Referred to widely as the Jewish Health Ministry, in the interwar period, the organization was twice conferred gold medals for its work at nationwide exhibitions devoted to public health and hygiene. We see one of these gold medal award certificates on the right. Public health education, so important to Sirkin-Binsteinova's work in Galicia, remained one of the, quote, paramount tasks of TOS. Over the course of 15 years of its existence, before the war, nearly 500,000 people attended TOS public health lectures. I would like now to turn to the period of World War II and the Holocaust. To open the final section on Sirkin-Binsteinova's work in the Warsaw Ghetto, I will start with this photo. Not from the late 1930s and early 40s, but from the early interwar period. Taken between 1923 and 25, we are in the offices of TOS in Warsaw. On the walls, we see graphs and charts tied to public health. Also hanging in a prominent place on the wall on the right, just under the added descriptive label, we see the photo from the 1923 Founding National Conference that we looked at a moment ago. However, the photographer's attention is on two people at a desk. Behind the desk is Sirkin Binsteinova, focused on her conversation with Gershon Levin, the chairman of TOS, who has pulled up a chair for the meeting. The photo will serve to illustrate the words of Dr. Moshe Tursh, a TOS director in the Warsaw Ghetto, who, in an unpublished memoir, describes Sirkin Binsteinova's unremitting dedication to public health work in the horrific conditions of the largest ghetto in Nazi-occupied Europe. It also serves to illuminate the connections between Sirkin's interwar public health work and the Holocaust. In his memoir, Tursh describes Sirkin Binsteinova as follows. When the epidemics decimated the Jewish population of Warsaw, Tursh wrote, Dr. Sirkin Binsteinova could not remain on the sidelines, but instead occupied one of the leading positions in public health in the ghetto, bringing with her, for the good of the cause, her enormous experience from the previous war and her unusual talents. Tursh continues, those who worked with her closely were full of admiration for how, from behind one small desk, where once a week doctors in refugee centers submitted their reports, a large department with an enormous reach emerged. With this as a starting point, I will turn now to describe briefly Sirkin Binsteinova's work in the ghetto in hope of making connections to her earlier work in the interwar period. When Germany invaded Poland in September 1939, Sirkin Binsteinova was already retired from medical practice. We know that from this 1938 document stored in the Central Medical Library in Warsaw. No information is given to explain her early retirement. However, the Nazi invasion of Poland plunged Sirkin Binsteinova back into the world of public health, emergency relief work, and the battle against epidemics. From September 1939 to November 1940, 90,000 Jewish refugees, POWs, and deportees streamed into Warsaw from the territories annexed by the German Reich, creating an overwhelming housing and health crisis. In late 1939, Sirkin Binsteinova assumed the role of chief physician of TOS, the organization she had played such a central role in creating, taking charge of the coordination of the medical care for these evacuees. By the spring of 1940, when the first two major waves of typhus epidemics broke out, Sirkin Binsteinova transformed what had become a medical sanitary unit serving the refugee centers into the TOS department for the combating of epidemics. Tursh details the scope of the department's programs, which echoes many of the public health measures implemented by Sirkin Binsteinova in Krakow and West Galicia. Almost two decades prior, in response to the first wave of the typhus epidemic, the department organized sanitary columns that would delouse typhus-stricken apartments. Because the epidemic was linked to the influx of new refugees to the Jewish district, the department also opened a public laundry earmarked to serve these refugee shelters. Simultaneously, on the prophylactic front, a broad-scale public information campaign was carried out, impressing on the inhabitants the importance of upholding personal hygiene, despite the inhuman conditions and chronic shortages of cleaning supplies. In January 1941, Sirkin Binsteinova's department was absorbed into the German-controlled Jewish Council, with her department for combating epidemics serving as the foundation for the formation of what would become the health department of the Judenrat. In addition to holding the position as the director of the health department, Sirkin Binsteinova also headed the office of the inspector of hygiene. In the Judenrat, she worked under Dr. Israel Milejkowski, with whom it appears she had very close personal connections. She also maintained close ties with another ghetto activist, Dr. Jakub Rosenblum, the disabled yet determined Secretary General of TOS. One of her important initiatives in the 9-month tenure at the council included the founding in June 1941 of the Chemical and Bacteriological Institute, a laboratory and research facility which, among other undertakings, carried out food testing to help prevent and control food-related illnesses and disease outbreaks in the ghetto, as well as the testing of vaccines reaching the ghetto, oftentimes clandestinely, to determine their quality and effectiveness. Sirkin Binštejnova's time as a director in the health department of the Judenrat came to an abrupt end following one of the most brutal of the German blockades and mass delousing campaigns, the Krochmalna Street action. Krochmalna Street was an overpopulated and particularly impoverished neighborhood, even by ghetto standards, and considered a sanitary problem and a source of infectious disease. Here is a photo of Krochmalna Street from the interwar period. This is an apartment on Krochmalna Street, and it's found in the JDC. On August 28th, 1941, at the height of the second typhus epidemic, German, Polish, and Jewish police, joined by members of the German Health Office, Polish doctors, and physicians of the Judenrat, including Sirkin Binštejnova, sealed Krochmalna Street. Residents were driven out of their homes and into the streets to await their turn to be led to the public baths. During the delousing of buildings, apartments were ransacked by sanitary brigades in search of anything of value. By nightfall, no food or water had been distributed to the residents, and 800 people remained in a public square awaiting their turn to visit the bathhouses. When soup was finally distributed to the starving residents 24 hours after the raid had begun, it was dished out into caps, fragments of clothing, and even into cupped hands due to the shortage of bowls and utensils. Dr. Wilhelm Hagen, the German health official for the Warsaw district, and by most accounts the chief architect of the Krochmalna Street debacle, passed culpability onto Sirkin Binštejnova. In a meeting with the chairman of the Judenrat, Adam Chernyakhov, on September 15, 1941, Hagen forced her dismissal from the health department. For the next 14 months, Sirkin Binštejnova remained active with TOS, and from some reports was captured in the line of duty with other medical professionals and activists and committed suicide with them on January 18, 1943. Now I'll take a few moments to make remarks for a conclusion. In his contribution to a collection of essays on women in the Holocaust, historian Gershon Bacon cites a census in Poland in 1931, which revealed that women constituted 52% of the Jewish population. Yet, Bacon argues, there is a dearth of scholarship on women in the interwar period. Exploring their pre-World War II lives grants Jewish women, the missing 52% of Polish Jews, a place and agency in history. The digitized archives of the Joint Distribution Committee allowed me to bring back the erased history of Sarah Zofia Sirkin Binštejnova's remarkable contributions to public life in interwar Poland. She was a woman medical doctor, a forceful institution builder, and an effective social activist. Institutions such as TOS and the School of Nursing are her lasting legacies. The insights gained from Sirkin Binštejnova's emergency medical work and from the formation of public health institutions in the interwar period allow us to better contextualize her public work in the Warsaw Ghetto. While the two eras are distinct, it was precisely Sirkin Binštejnova's experience organizing the anti-epidemic campaigns and TOS in times of profound humanitarian crises after World War I that help us understand how she came to assume leadership roles in formulating medical relief and public health responses to Nazi occupation. Scholar Dalia Ofer writes that in the Warsaw Ghetto, Sirkin Binštejnova was, and I quote, a most creative personality in a most desperate situation. The JDC archives clearly show these words are equally apt when considering Sirkin Binštejnova's early interwar work on the front lines of the disaster response in West Galicia and later in building the National Jewish Health Organization, known popularly as TOS. I'll stop there and leave time for any questions you have. Thank you.
I think Juliet can field her own questions, so let me, please.
Oh, okay. Well, just if anybody has any questions, I'll be happy to address them. If there are any, yes.
The contrast between Warsaw and the rural areas seems pretty extreme. That Sirkin was based in Warsaw the whole time that she was doing this, but the schools and so on were that where she was educating the children and so on, were in rural villages and areas? Is that correct?
Yes, I think partially. So yes, she was mostly in Warsaw with the exception of the earlier period where she was in Krakow. But they understood that the problems with the epidemics were rural and urban problems too. I would say that they were concerned with dealing with rural areas. Oftentimes she was meeting in rural areas, trying to engage local doctors to help with the humanitarian and health crises there. So it was really institution building from ground up. I would say that's one point I would make. Secondly, though, for urban children, urban areas were in highly polluted, people living in dense conditions, in very poor conditions, perhaps better than the rural areas, although when we saw the photo of Krochmalna Street from the interwar period, we see that people living in cities were also living in absolutely impoverished conditions. However, the part of the TOS program for children was summer camps. It's a very important area that I'm very happy that there are some scholars that are now working on this in depth. And so urban children were sent often to rural areas for those summer camps to have fresh air, have place to move, and also to be cared for in a very focused way. And also because it allowed them to get healthy. If they lived in the city for day camps, and there were day camps, they were always returning to the conditions at home, which impeded their progress on their health and physical conditions. Thank you, though, for that question. Yes.
I'm struck by how much latitude the Polish Jewish community or the organizations that Sir can work for, and try to say her last name, in light of the fact that right at the very end of the First World War, I was always under the impression that there was an enormous amount of Polish-Jewish tension, pogroms, and that the immediate post-World War I situation was really pretty just generally dysfunctional. And if you could just say a little bit about that.
Yes, I would say that there was a great deal of creativity in response to these problems. I think that part of that answer is the fact that the communities were still segregated, and there was a problem, and the problems overlapped and were interlinked, and so the Jewish health problem could not be ignored by the Polish government. I think the involvement of international humanitarian organizations such as the JuSt bringing large funds to the country also created a certain latitude, and ultimately it became the JuSt was handling the Jewish health and taking initiatives for Jewish health. There were a lot of tensions between the JuSt and Polish Jewish activists such as Sirkin and the Polish government. One case study, which I could only touch on, is the nursing school. For a very long time, the JuSt was asked to give money for certain projects important for the Polish government, for example. So the Jewish organizations were trying to negotiate then inclusion of Jewish students, let's say in the nursing schools and the Red Cross nursing schools and other institutions. Many of those battles were lost, and that's why there was a Jewish nursing school that was opened. So there's a lot of tension going on. I think the School of Nursing is a very good example, and TOS was another good example as well. I think it took 8 months to negotiate the statute for the creation of TOS, and that was because of conflicting interpretations of the legal status of TOS and the individual organizations outside of Warsaw that the government wanted to accept or didn't want to accept. It's very complex, but there was tension going on the whole time. Yes, back there.
Thank you for a fascinating talk today. I have just 2 questions, if I may. The first one is, where in your archival work have you found her voice? I wanted her to be speaking to us through her own traces, in a way. You found so many rich examples of her impact, and you've also hinted at moments where she was clearly spoken for and spoken about. So I'm interested to know where you're finding her own voice in the archives. And the second question really is, since Jews are targeted as carriers of typhus, and it's part of anti-Semitic German attitudes in World War I in the 1920s, prior to their almost caricature as target-bearing Brazil by the Nazis and all that awful stuff, then how do you tie in your own work, how do you tie this all together with it was more than just attitudes and racism, it influenced German policy toward migration and border crossing, all of that, so they were being targeted in this way, in politics as well as if they were poor, literally suffer from the disease. So I'm interested in that how often they were blamed for it. Paris knows no borders, of course, and knows no race, but at the same time they were associated with it in public discourse. So how, in your work, are you finding that being at least mentioned, or maybe it's not mentioned?
Okay, well, I would say, I appreciate both questions. Yeah.
Maybe Thompson is combating this with its public health directives and so on.
Thank you for both of those questions. I'd like to start with the first one. It's so important to me because I had there were very few ego documents, if I could say, or any personal essays, personal writing. It was very painful for me because I really wanted to hear her voice. And there are very few places. I found the article that I published is called "Show That You Are Really Alive." That's a direct quote from minutes in a conversation on public health in a community outside of Krakow. And she gave this very impassioned speech to local residents, encouraging to get involved in helping fellow Jews. And so it was show that you are really alive to the problems of your community. And that fragment is one of the only moments in the documents where I hear her voice. Other than that, I have found very few pieces of information. Maybe in the application, in the Central Medical Archives, there was the document that she had to fill out for the Jews had to register, Jewish doctors had to register and give their background and things. And so through some of those words, you get a little bit of her experience. It's the only place I found mention of her husband, for example, that he's the one that took this document to the notary public to have the translation notarized. But there are just really very, very few traces. I have not found anything other than that. And that's really very painful, I think, after finding so much information in the archives, especially of the joint. In terms of the other, it's a very complicated answer of how to deal with it. I think that I would separate out the interwar period and there are contacts, but the interwar period and then later the period of Nazi Germany. But it's very complex. We were speaking a little bit a moment ago, the eugenics movement in Poland was strong, in Central Europe was strong, and many of these Jewish doctors were eugenicists. And in one of her documents, she talks about a proclivity of Jews to have typhus. And so she weighs on that. She says there are conditions, the conditions, the poverty that all leads to it, but also that there's a genetic proclivity toward typhus. So I'd say that only to point to the fact that the influence of eugenics was very strong and that the answer is very complicated and the response was very complicated. I found that really, I write about it, I put it out there, but I found just it's very surprising in it. There is some work being done on that work too. So I just want to point to the complexity of that issue as well. I think by the World War II period, it was very different. And when the Warsaw Ghetto was created, you have, it's a very different, the death world of Nazi occupation took on its own, has its own features, I would say. I hope that answers your question. It's a very complex question, but yeah.
John, before I forget, maybe you could just send a publication or two of yours to me, and we can put it on our website for those people who might want to look at it.
I'd be very happy to. Thank you very much.
Just a brief question. This was such a beautiful presentation, and the images and the whole story story that you put together, like I felt like getting this big picture of the transition of the country also, right? Through this story that was just so beautifully and powerfully done.
Thank
I
you.
have just it's actually a small question I was thinking, but it's actually been describing the interwar period. And it was so interesting talking about overseeing the physicians coming into the homes, overseeing the cleaning that was done by residents, or physician overseeing it.
Mhm.
Do you have any indication that there was any pushback to that?
Mm.
Any resistance to this idea of like a stranger coming into your homes, or was that sort of more just sort of welcome and accepted?
I think we need to accept that this was really invasive, and I think that there are, in some of the documents and some of the flyers encourage cooperation, that this is important for you, but please understand, by law, we can also come in and just do this. So it's encouraging cooperation. Unfortunately, we don't have the voices of the others as recipients of this policy. So I think there was an effort to encourage and to inform why this was important, but I'm sure that, these were impoverished people that had very few belongings. Oftentimes their sleeping materials had to be disposed of because there was no way of getting rid of the vermin or of lice in there without destroying burning these little belongings that people have. So I think it's an important question. I don't have complete information about that, but it's a really important question to consider.
We always try to be cognizant of people's schedules and getting to classes, including those online. So let me ask everybody to give Dr. Juliet Golden a big hand and a thank you for speaking to us.
Thank you very much. Thank you.
Thank you.